welcome on stage first, SPIXII, please.
Thank you.
Welcome.
Good morning, everyone. My name is Roland Million, co-founder and CEO of SPIXII. SPIXII, it's a platform removing friction in high-value services. We are part of the Kickstart Accelerator and a health and well-being cohort represented by Katka and Claire. What do we mean by high-value services? Usually, this type of services that deliver face-to-face. They can also be done over the phone. Let's say if you call your health insurer or kind of your doctor also sometimes. And you can also have some web form. They start to be digital, but not really, because there are like so many exceptions that it's really, really hard to digitalize this type of services. But what we see is like individuals, organizations, SMEs, they want something which is online, easily accessible, with immediate outcome, immediate response. They really have an aspect of saving time. An organization, and as we've seen in the theme today, is like creeping cost and a lot of pressure on the system. They want to be more efficient, but also more resilient, to be able to accept more customers every year without having to restructure the operations all the time. And of course, increase customer satisfaction and win more market share. Automating this type of services, we call it the true self-serve, and I will show you one example later. Just bear in mind one this key fact is when it's done manually, this type of decision on high-value services, it takes up to maybe 50 minutes, taking into consideration a 10-minute wait, 20-minute conversation from individuals, and 20 minutes on the other side from the organization. Once automated, it can take just 2 minutes on average, because it goes really, really quick. So one case study in health. So it's for a large health insurance company based in the UK. It's a 15 billion revenue health insurance global, and here we work with their international part. To take an example, think about like insuring an expat who lives in Geneva. I need to see like a cardiologist in the afternoon, and using the manual process that was done by the insurance, it can take up 3 working days. This person will call the health insurance and say, can I see a cardiologist? They will be like, oh, you need to take your name, understand your symptom, map it to an ICD code, check your benefits, check your policy. It will take me a bit of time and I will come back to you. But this person is like stressed, feels something bad, needs something immediate. Back to the principles of the first slide. And this service was only available during the working hours when people were just working. And it requires not just the average person in customer service, but someone quite trained to navigate various systems. So that was really complicated. And here we are talking about 500,000 customers all around the world. So they wanted to automate this for the last 10 years, and since 4 years we've been working with them, and we kind of mapped all the different journeys, explain all the symptoms in a customer-friendly manner, yet map them in the background to ICD codes to automate to the systems, and then created like powerful analytics. So they know exactly when the requests are coming, from which part of the world, at what time of the day, etc., etc. The results are amazing. So we are talking about like 10,000 pre-authorization per month, like more than 100 per year. And it's basically creating the work of like 10 to 12 people, like 60 uninterrupted man hours per day. So it's a huge scaling factor for them. And it's like request dealt in 2 minutes, 24/7. And they save a lot of time. And they can grow every year as they do like 10% per year in customer base without needing to hire more people. And they can focus on more different and more complex problems. So other type of high-value services, and of course I will be here to discuss them with you later. We are just in the other hall. It could be like the questionnaire before and after operation. They are quite lengthy, they are quite complicated, and if you have pre-existing medical condition like a previous heart or brain surgery, then it's not 5 questions, but maybe 20, and the quality of this answer will impact the outcome after the surgery. This is really poorly done right now, and this is a way to capture the data better with the patient in an intuitive way. It could be the real-time reimbursement of complex drugs, which are usually takes forever. After a consultation, the doctor will fill a form, or their secretary sign it, send it to the insurance company by post. An insurance company will analyze it and then come back. It takes really a lot of time. These are plenty of examples that you can see on the slide, and happy to discuss it later with you. Based on AI expert system, there is 100% accuracy. It means once your process is codified, it can be basically replicated in any language, which is really powerful in a country like Switzerland when you have like at least 3 languages, but also for this health insurance company with a lot of, for instance, clients in the Middle East. And all the acronyms in health are really different in terms of culture and what they mean. For instance, like for maternity care, there are some different acronyms in the US versus Europe, et cetera, and it's all about understanding. That's it. We are a niche, profitable software provider, so it means we support our client for the long term. We're not relying for the next funding round and might disappear in 6 months. We've been here for 8 years. We are ISO certified for security because this type of process are really touchy and there is a lot of compliance behind it. And that's it. And I didn't hear you clap, so maybe I'm on time. Thank you very much.